That nurse who was quarantined after arriving in Newark yesterday from West Africa, we've learned has tested negative for the virus. But that's not the end of her story. Casey Hickox was extremely critical of her mandatory quarantine, and she wrote a piece about it in this morning's Dallas Morning News. Here's part of that. She says, quote, "I've been quarantined in New Jersey. This is not a situation I would wish on anyone, and I am scared for those who will follow me. I am scared about how healthcare workers will be treated at airports when they declare that. They have been fighting Ebola in West Africa. I am scared that, like me, they will arrive and see a frenzy of disorganization, fear, and most frightening, quarantine." Joining me is Dr. Seema Yasmin. She's a staff writer at the Dallas Morning News and a former CDC detective. Also here with me in New York, CNN medical analyst Dr. Alexander Van Tulleken. Dr. Yasmin, I know you worked with the quarantine nurse, Casey Hickox. What are your thoughts on this new mandatory quarantine that we are now seeing in both New Jersey and New York?
The concern here, Anna, is from public health experts who are saying that these policies don't align with the science and that politicians are responding to fear from some sections of the public, but that really it's actually causing more fear because people are now scared about healthcare workers returning. The science tells us that if you don't have symptoms, you are not capable of transmitting the virus to anybody else. And what public health experts are also worried about is that because they weren't notified about these policies, they're not prepared to provide quarantine appropriately to the many, potentially hundreds of healthcare workers, US military who will be returning to West Africa. And they really need to make sure that if there is going to be quarantine, they have the time and the facilities to be able to do it properly. At the moment, we know that Casey is in an unheated tent outside of Newark University Hospital. She hasn't been allowed to shower. She doesn't have her personal belongings with her. And this is a very frightening situation for her and potentially many other healthcare workers.
So, Dr. Van Tulleken, we spoke with Dr. Fouclet last hour, and he talked about getting ready to go over to Liberia and his concerns about potentially returning and having to deal with some of these procedures. Is this unfairly punishing these healthcare workers who are really risking their lives to go save lives?
Well, I think the issue is not punishing them. I mean, it doesn't, I think most healthcare workers who are volunteering to work in these situations are quite happy to endure a huge amount of hardship in the field and if necessary when they return home. The objection to this is it's not only not necessary, it doesn't prevent any transmission of Ebola here in the States, but also that it costs us a huge amount of money in terms of enforcement, costs a huge amount of money in terms of screening, and that doesn't affect our risks at all. It actually makes it harder to work in West Africa. We've heard from the governors that they're, that how much better the response has been in New York City, and yet this seems to have been incredibly poorly thought out. And they've either got to say, why didn't they change the guidelines months ago, or they've got to admit that this is bad policy.